Hello, everyone. I am Janice Whitaker, CGNE Administrator and Community Liaison, and it's my pleasure to welcome you again to the Fall 2021 CGNE Seminar Series. Today's seminar is entitled Stories from Nurses on the Front Lines of the COVID-19 Pandemic, and will be co-presented by Dr. Mike Evans and Kiernan Riley, one of our amazing CGNE affiliate PhD students. Before the seminar begins, I do have some announcements and disclosures to share. This seminar is being recorded. If you're in the room with us, please silence your cell phones. If you're on Zoom, we do ask that you remain on mute, and you can use the gallery or thumbnail format to see both the PowerPoint slides as well as those speaking. We have enabled both the Q&A and the chat features for you. Please put questions into the Q&A and comments into the chat. These will be addressed during the Q&A discussion portion of the seminar. The post-event evaluation survey link will be placed into the chat feature at the end of the seminar, and it will also be emailed to you within 24 hours. The evaluation must be completed within 1 week of the seminar. While it's required for registered nurses seeking contact hours, we ask that all attendees complete the post-evaluation in order to assist with data collection related to our center activities, as well as our age-friendly care PA initiative. Contact hours certificates will be emailed to registered nurses meeting the requirements within 1 month following the seminar. Penn State Ross and Carol Nese College of Nursing is an approved provider of nursing continuing professional development by the Pennsylvania State Nurses Association, an accredited approver of the American Nurses Credentialing Center Commission on Accreditation. At this time, presenters, organizers, and content specialists have indicated no conflict of interest. This activity has been submitted for 1 contact hour for participants who hold a valid RN license, attend the entire session, and complete the evaluation. Partial contact hours are not awarded. This program is being provided by the Penn State College of Nursing's Tressa, Nese, and Helen Diskevich Center of Geriatric Nursing Excellence in collaboration with the Center for Nursing Research and Age-Friendly Care. If you have any questions or need any additional information, please feel free to reach out to cgne@psu.edu. And now another one of our amazing PhD students will introduce our speakers. In addition to working on her doctoral degree, Jenny Connect Friedo is a nurse practitioner who serves as education coordinator for the Age-Friendly Care PA initiative. Thank you for introducing our speakers today, Jenny.
Of course. Hi. So first, I'm going to introduce Dr. Evans. Dr. Michael M. Evans is the Assistant Dean for Undergraduate Nursing Education at the Commonwealth campuses and a professor of nursing at the Penn State University, Ross and Carol Nese College of Nursing. Dr. Evans is board certified in medical surgical nursing and nursing education. Dr. Evans is published in the areas of nursing education and clinical practice. He volunteers his time as a research reviewer for the Academy of Medical Surgical Nurses. He's also a member of many professional organizations, including Sigma Theta Tau, International Honor Society, National League for Nursing, and the Academy of Medical Surgical Nurses. Dr. Evans earned an Associate of Science in Nursing and his Bachelor of Science in Nursing from Penn State, and a Master's of Science in Nursing with a specialization in adult health and a subspecialization in nursing education from Misericordia University. He also earned his Master of Science in Education with a focus in professional studies from Capella University and his PhD in nursing at Penn State. He lives in Archbald, Pennsylvania with his wife, Stephanie, their son, Finn Michael, 2 dogs, Duncan Hines and Sweet Polly Purebred, and their cats, Andrew Michael and Prairie Dawn. Kiernan is a fourth-year PhD student in the Ross and Carol Nese College of Nursing at Penn State. She is defending her dissertation and hopefully graduating this semester. You got this, Kiernan. Kiernan has been a Penn State student since her undergraduate education, in which she received her BSN from Penn State Scranton. She has focused her graduate studies on persons with severe mental illnesses and end of life, period, along with qualitative research. And she has earned her nursing education certificate as well as her primary palliative care certificate. Following her PhD, Kiernan is hoping to pursue a postdoc research position. She has published in areas of end of life and severe and persistent mental illness and intends to continue to pursue this as her research trajectory.
Well, welcome everybody. Thank you for joining Kiernan and I today for our presentation titled Stories from Nurses on the Front Lines of the COVID-19 Pandemic. So first, I want to start off with some acknowledgements. We'd like to acknowledge the generous funding from the Penn State Arts and Design Research Incubator. I know Dr. Bill Doan is on the call today because he sent me a good luck chat. So thank you, Dr. Doan, for collaborating and also helping with the funding through the Arts and Design Research Incubator. We'd also like to acknowledge the valued contributions of our other team members. Logan DeSanto, who's a senior honors nursing student who should be in attendance today, I believe, watching at Penn State Scranton. Kalei Kowalczyk, who is a BSN to PhD student in the Nese College of Nursing. Dr. Bill Doan, professor in the School of Nursing. And our mentor on this project, Dr. Marie Boltz, who is a professor as well in the Nese College of Nursing. We'd also like to thank our participants who graciously shared their stories with us. So background, I'm going to start even before this. How did this project even get started? So this project really started from listening to the news, seeing the bottom of the news scroll by, listening to the radio about what was going on in society when the COVID-19 pandemic overtook. We all remember pictures of New York City with nurses working tirelessly, and then it has spread throughout the country. And all of us being nurses except Bill, but Bill is very passionate about healthcare. We all got together and thought, we really wonder what the nurses and other healthcare providers are going through, but we stuck with nursing and we should really talk to them. And that's how this all got started. So as we know, nurses have been working tirelessly during the COVID-19 pandemic for over 18 months now. That is a long time to be putting on PPE. So far, it has killed over 675,000 Americans, more than the Spanish flu pandemic in the early 1900s. And this number continues to rise, I believe, at around 2,000 people per day right now. So we put this picture up. I don't know why my Zoom screen is showing, but I can't read the very top, but I know it says the public perceives nurses as heroes, which they are, but we have to remember they are suffering. They're suffering from burnout. They're working long hours, sometimes 12-hour, 16-hour shifts, 4 to 5 days a week. They're facing isolation, afraid, especially pre-vaccine, that they were going to bring home COVID-19 to their loved ones, some living in trailers or different living arrangements away from their family. They're scared. They're seeing people their own age without comorbidities dying. They have compassion fatigue. They are doing all they can to keep people alive and yet not succeeding all the time. They are tired. And frustration in many levels, frustration with the public, frustration with the healthcare systems. So we put this little picture up here to show the strong nurse, the COVID-19 virus, and society. And this is a constant battle. We're trying to fight the COVID-19 virus along with public misperceptions that are going on regarding the need for vaccinations, masking, and physical distancing. And it still continues today, amazingly, 18 months later. The purpose of this research was, one, to explore the experiences of frontline nursing staff during the COVID-19 pandemic. Two, to explore the feasibility, acceptability, and perceived efficacy of storytelling with frontline nurses as both a qualitative methodology and therapeutic group process for nursing staff. This was an IRB approved study through Penn State. In the top right-hand corner, you could see the flyer. Kudos to Calais for making the flyer look pretty, as she always does, that we shared on social media and also emailed to healthcare leaders at various facilities. We used a qualitative design using story circles, which Dr. Doan is an expert in. We used purposive sampling. Interested participants, after seeing the flyer, would contact me as the PI. I would let them know of available dates for a story circle session. If they were able to make an available date, they were emailed the demographic survey, which I'll talk about later, to complete prior to the story circle. Inclusion criteria include nurses, RN or LPN, but we only had RNs that signed up for the study, who can read, write, and speak English with at least 1 year of experience and who worked with COVID-19 patients in any setting for at least 1 month. Group interviews were held via Zoom. Sizes ranged from 2 to 6 participants. Our initial goal was to have about 5 participants per session, but due to scheduling and nurses' availability, that was not always possible. We held the interviews at all times during the day because we had people from all over the country to try to accommodate their schedules. All participants were asked the same 3 questions. Tell a story about working during the COVID-19 pandemic. Tell a story about how this experience has impacted you professionally. And then finally, how this experience has impacted you personally. All participants were given 3 to 5 minutes to share their story. So what would happen is we would ask one of the participants the question, they would be given the time to share their story, and then we would move on to the next participant and all the participants in the session to answer that first question before we went on to the second question. At the end of it, we asked if there was anything else they would like to add. The data was audio and visually recorded, de-identified, transcribed verbatim, stored in a password protected online cloud in the computer using OneDrive. Analyzed for codes and themes using the research team. Pre and post surveys were collected. Pre-surveys for demographic data, post-surveys for participant perceptions of utilizing story circles as a therapeutic intervention. All participants who completed the pre-survey participated in the story circle, and then the post-survey were sent a $15 digital Amazon gift card as a thank you. I'm now going to turn it over to Kiernan Riley to share the results. Kiernan?
Thanks, Mike, for introducing the study and the methods. So I'm going to be focusing on the results. So first, we'll talk about the demographic data. So we had a total of 14 nurses partake in story circles, 13 females and 1 male. Most were Caucasian with the BSN and all spoke English as their native language. And we had participants from many different areas of healthcare, so including urban and rural settings. And we had nurses representing the ICU, the emergency department, telemetry, hospice, oncology, and long-term care. So first, I'm going to talk about the results from the coding of the story circles. So there was 2 overall themes. The first one we're going to talk about was titled Navigating Uncharted Waters. And this first theme, which has 7 sub-themes, really represents sort of the negative impact on nurses going through COVID. So the first sub-theme was healthcare mistrust. And this was talked about by the nurses of even their own mistrust of the healthcare system, having new guidelines put out every day, kind of learning as they went, old guidelines being thrown out the window, not a lot of unsureness. This caused a lot of healthcare mistrust from nurses for their organizations. So a quote that really represented this was, we had nobody to fight for us and say, absolutely, we deserve a raise. And so that was just another punch to the gut that here we are really truly putting our lives at risk. You know, I think I just saw a statistic that there were 3,600 healthcare workers who died during COVID, you know, exposed on the job. But yeah, that's just kind of what came to me, but that made me angry. The second sub-theme was fear of COVID-19. So this was fear of catching COVID-19, of spreading COVID-19, of bringing it home. And one of the quotes that we saw that really illustrated this, a participant said, "I was completely exhausted and I felt like, crying and screaming and terrified that I was going to get it. Terrified that I was going to take it home to my kids and my husband. So initially it went from just exhaustion and fear to realizing that I was in this for the long haul." That's a really illustrative quote of kind of the emotions behind that fear. The third was stress and loss of control. So this was just stress that nurses identified walking into their work environment, that loss of control, like they're not able to really manage what's happening in front of them. A lot of discussion about PPE. A quote that one of the participants said that illustrated this was, and just feeling like I was so hot, like I couldn't breathe, and just a sense of claustrophobia. And eventually I was like, I'm not done, but I have to get out of this room. I thought I was going to pass out, and so I did. And I remember feeling that sense of claustrophobia and just that super extreme heat for a couple of weeks, referring to the PPE. So moving into some more of the sub-themes of this first theme of navigating uncharted waters, we heard a lot of nurse exhaustion and burnout. This was really common throughout the story circles. You could almost just hear it in their voices as they were talking. One of the quotes that really exemplified this was, "I'm definitely more numb towards nursing than I have been before." And that has translated into my personal life as well. I've had to start therapy again because I have to learn to feel again, because I was so overwhelmed by everything that I stopped letting myself feel things. I actually purchased a burnout survey for myself to see where I was at, and I scored very high on the burnout survey. I passed it around to my coworkers, and they all scored very high on the burnout survey. And listening to all your stories, referring to the story circle, I know you'd probably score very high in the burnout survey. So know that you guys aren't alone. And when we're at a time when we really need nurses, it's so hard to hear that nurses are feeling so exhausted and burnt out. So that was a struggle to listen to as an investigator. The next sub-theme was advocate, and we know that this is generally a part of the nurse's role, advocating for themselves, advocating for patients. And this was really brought up in interviews, that they felt as though they were advocating for themselves as nurses, their patients, and almost like the entire community. One of the participants stated, "I've been a nurse for 3-4 years, and I was like, I'm not letting somebody die by themselves. I couldn't do it. I pissed off the manager of the unit because I went against what they said. But I said, screw you, no one's dying alone." And basically the guy, he woke up, looked at me, kind of a breath of a sigh of relief, and passed away. It was immediate. But that being said, it's been sitting with me since, because I have patients that are literally dying alone in the ICU. And unfortunately with this virus, we're still having issues with COVID. I mean, I've been now doing them for 2 years. We still have people who are dying alone. And in this quote specifically, we heard a lot of emotion coming from the participant. They were very choked up when telling the story, which we actually saw quite a bit throughout the interviews. So more of the sub-themes from the first theme, another one was community frustration. And this was frustration from the nurses with the community, feeling as though the community wasn't taking it seriously or wasn't taking the proper precautions, really juxtaposed what the nurses were seeing in their day-to-day work life. So I'm just going to read one of these quotes. The first one: "Just going to the grocery store makes me so mad because you just see people that don't care. Going on social media makes me so mad because you just see people that don't care and they haven't seen what we've seen, and it's just so frustrating because if everyone did the right thing, we wouldn't be here." So just that feeling of frustration and watching the difference between their work life and what's happening around them. And finally, social isolation. So a lot of nurses reported feeling that they were isolated socially because of their jobs, whether it was a choice or not a choice. There was that social isolation of working as a nurse throughout the pandemic. One nurse shared that when I first got my wedding dress, I wanted to go over and show my parents and my dad, wouldn't let me come over. Again, we heard emotion here, to even show my parents my wedding dress. So again, these are really difficult instances happening outside of work for these nurses as well. So the second overall theme that occurred was persisting through the COVID-19 storm. And this was actually, it was really interesting to hear the nurses talk about sort of positive things that may have come from working through the pandemic. So these 4 sub-themes really represent that positive aspect that has happened to these nurses as they've been working through the last 18 months. So the first sub-theme was change in perspective. So nurses really identified that they had a change in perspective either of their own trajectory as a nurse or how they're caring for the patients. The quote that I'm going to read, she talks about how she's considering a different type of nursing now, which is really what we'd like to hear because when we're talking about exhaustion and burnout and some of the other themes, that's people potentially leaving the profession. So changes in perspective to sort of flow through the profession, maybe into a different specialty, are things that we like to hear as researchers to maybe show how not all nurses will feel the need to leave the profession because of this. So one participant stated, on the flip side of that though, it really made me think if I want to stay in oncology specific or if I have been seriously thinking about going into hospice nursing. Because when I worked inpatient, I did deal with end of life situations a lot. And with so many people dying through COVID, it's kind of brought that into my head of like, you know, people need to be there. And I'm good with that type of a situation, as weird as that sounds. But, you know, maybe I should explore that and that would be more meaningful to me. Another sub-theme that was a little bit more positive that we saw was an increased confidence and skill. Nurses said, you know, we've been working with changing guidelines at the drop of a dime and all these different aspects to care. And it's enhanced their own skills as nurses and they feel that. So some participants stated working with only 1 or 2 other critical care nurses, not any doctors around, it did give me a sense of confidence. It made me think more critically. And another participant stated, I feel proud of myself, like proud that I was thrown into a situation like this and I've handled it as well as I have and was able to adapt. And then the last 2 sub-themes, again, representing some of the more positive aspects. The first is understanding self-worth. So nurses stated that they really felt as though they kind of came into their own throughout the pandemic. One participant stated, so this impacted me professionally because it is, and this is going to sound so cliche, but it's so true. It really taught me about the value of life. And finally, the last theme that we noticed during the interview, that we noted during the interviews was innovation. And this was innovation of nursing care, providing care when it seemed impossible at times. One participant gave an example. There's like 4-ish nurses and almost all of the patients were intubated. So they're all on blood pressure medicines and sedation medicines and all kinds of drips and all that stuff. And we ran our medicines outside the room. So the IV pump was actually out in the hallway and we had long extension tubing that would go under the door to the patient that way. And we could change our drips and stuff without having to go in and get gowned up every time the IV beeps. So again, in this situation, we're seeing moments of innovation that wouldn't normally be occurring under non-pandemic circumstances. But we could also see the downside to innovations like this. If your IV pumps are in the hallway and you're hanging meds always in the hallway, you're not ever able to check that IV site or check for infiltrations or anything like that. So, but this was just one example of an innovation that the nurses identified was necessary because of COVID. And finally, I'm just going to talk about the post-survey results. So one of our aims of the study was to examine the feasibility and efficacy of story circles in being therapeutic for patients or participants or beneficial to participants. So we had a post-survey and it had a couple of questions related to this with 1 to 10 scales that the participants could place how they felt about how beneficial or validating it was. And we found that the majority of participants found the story circle to be beneficial in sharing their story. And they also found the story circle to be helpful in validating their feelings while caring for persons with COVID-19. And then they also felt that the story circles were very impactful to their mental well-being. And kind of off what we didn't really capture in the surveys, but what we saw as qualitative researchers was there was, even though these nurses didn't know each other when they came together in the story circles, we did see such a sense of camaraderie and almost building off of each other's stories and identifying themselves in each other's stories. So it really was awesome to watch live happening with the story circles. So I just wanted to throw that in there.
So, well, as Kiernan said, it was really emotional sometimes to be involved with these interviews and see what these nurses were and are going through. So some conclusions. Nurses have proven to be resilient and innovative, but how long could this last? We see it now every day that nurses are leaving the profession. In my area, which is in Northeast Pennsylvania, we have institutions offering sign-on bonuses for nurses. The highest I saw was $25,000. And we know that nurses are leaving. There's a variety of reasons. We didn't do that research, but I'm sure one of them is because they are tired, exhausted, and burned out. Change is needed, and we need to not only focus on recruitment of nurses, as many institutions are, but also retention of those nurses that have given their all for the last 18 months and many years prior to that. Our data suggests that story circles are an effective methodology to help participants validate their feelings and helpful to their mental well-being. So maybe this is something that, I work in hospice and sometimes we'll have debriefing sessions. Maybe this is something that institutions can implement to help nurses get over this difficult time. Implications and needs for future studies. Examine interventions that could help nurses when navigating uncharted waters. This is unlikely to be the last pandemic, hopefully it is, that we face, but unlikely. And nurses are always going to be involved in difficult situations. Future studies also need to examine the effectiveness of story circles in other populations to examine the feasibility as a therapeutic process. A limitation of this study is we only had 14 participants, all RNs. So we need to know if this could also work with other healthcare providers. And also replicating the study with a larger sample size using a longitudinal design. So checking up with these nurses every 6 months. What happened? Did they leave the profession? Did it get better? And we are at our last slide, and Kiernan and I are more than happy to open it up to questions, comments, feedback.
Well, thank you so much, Mike and Kiernan, for an amazing presentation. The study was very interesting. And what we'd like to do next is to open it up to questions and discussion. Are there any comments in the chat that you can share? Or
there are.
Okay.
Ray Brown has asked, what suggestions would you have to prepare our senior undergraduate students to enter this type of environment?
Let me take that, Kiernan.
Sure.
Ray, that's an interesting question, and one that you and I and all the undergraduate faculty and administrators battle with every day. They are entering the profession in a time where there's less orientation. New nurses are the norm. So I think it's imperative that our students get involved with internships, externships, working as nurse aides, and demand the orientation that they deserve to feel comfortable working. There's nothing wrong with saying, I'm not prepared. What can we do as an institution? Continue to get them out there in the clinical agencies, continue to get them good clinical experiences, which I know we are, and really promote their clinical judgment and reasoning, because they may be making life and death decisions in a year from now.
Kiernan, do you have anything you'd like to add to that?
No, I think Mike sums that up. I agree. I agree with Mike on that. So.
Okay.
Could I add one more thing to that?
Oh, sure.
So, and I know the college is working on this initiative. We also have to teach our students of all levels wellness, to how to take care of themselves and self-care. Because no matter what the job is, but we know nursing is demanding, they need to know how to care for themselves, or they're not going to be in it long, unfortunately.
Yeah. And actually, Mike, I was going to share this as a reminder at the end of the session, but since you brought up self-care and wellness, next week, our presenter is Dr. K, who will be talking about Speaking Grief Part 2, but the focus is on self-care and wellness while you're supporting others during grief and loss. So I think it's very relevant to a lot of what you've shared today, and a way to maybe start working on some of those themes that you identified. So I wondered a little bit about, the value of the story circles in terms of identifying those themes and what you might see as kind of next steps to address some of those themes that were identified as you analyzed your data, as well as strategies to promote the positive aspects of what you found. Do you have any thoughts about that?
I could answer the first part of that. I felt like story circles were extremely useful for this specific question. And I could see its usefulness in other questions too, just because I've never had, in any of my qualitative studies, I've never had participants just talk freely for 3 to 5 minutes and fill up that amount of time. And it was really interesting to watch people kind of walk through their stories. And, when Bill started each session, because he was the expert, he kind of told, stories have a beginning, a middle, and an end. So try to think about that when you're responding. And I've just never had, I felt as though all the participants, even when they weren't the ones telling the story, were very engaged. And I just felt like it was a really good method for getting at this kind of emotional sort of topic, because it gave people the time to really think through it and respond.
Well, I think that added value of the validation of their stories and their experiences was also, I'm sure, very important to the nurses. So we do have a couple of hands raised. So I believe we'll go to Susan Lowe.
Super. First off, I would like to thank Kiernan and Mike for a wonderful presentation and very enlightening. 2 questions for you. The first is, you spoke of the fact of frustration by some of the participants in your study when they'd go out to the market or, those sorts of situations in the public. Did any of them provide any insights through their stories about frustrations with colleagues that perhaps weren't getting vaccinated, or even when they spoke of the hospital administration and lack of trust in the vaccine itself and rationale why they weren't getting vaccinated? I was curious about that first.
So Susan, that's a great question. When we did this interviewing last spring, the vaccine was still relatively new, and I don't think there was they didn't know what coworkers were not getting the vaccine yet and things of that nature. I don't think we were at that point in the pandemic. One frustration though, Susan, I know this wasn't your question, but I wanted to share with everyone. Several nurses brought how they would get dirty looks from people if they stopped at a grocery store, assuming they were bringing like COVID into the grocery store and things like that if they had their scrubs on.
Thank you.
And I think to build on that, Mike, I was reading through quotes this morning, and one of the quotes was talking about how, they go to the grocery store and they're getting terrible looks, but then they go to their family's holiday and it's 6 families sitting in a room without masks on. And where do they land kind of on that spectrum of how to deal with COVID in the public?
Good. Thank you both. And then the other question I had for you was a methodological one. My team's not been able to get into the prisons yet to conduct data. However, we have developed protocols for doing focus groups and other related methods that are fairly closely tied to things you're doing. Do you have any best practices you can share with us in terms of conducting these kinds of sessions virtually?
So Susan, sorry, Kiernan, go ahead.
I would say, I think one of the things that made ours go the smoothest was we had a really skilled moderator. Bill Doan was awesome during facilitating the story circles. And I don't know if he's ever done anything like this on Zoom, but he seemed like a natural at it. But he just kind of kept everybody on track and left pauses and time for people to think, which I think you have more organically in person. But I think the secret for us was definitely having a skilled moderator and understanding the methodology and the questions.
Thanks so
Susan-
much, Kim. Oh, go
Susan,
ahead.
I was going to say being flexible. Well, two things. First, I met with Nick, God love him, and I made him go over all the Zoom settings 20 times to make sure they were set up appropriately, and that everything was password protected for security reasons and things of that nature. And second, being flexible. Some participants had a call in, their computer wasn't working, and things of that nature. So just kind of rolling with what worked for the participant.
All right, I think I've taken enough of your time. Thanks so much. So great.
Thank you, Susan. We're going to take a question in the room here from Marie Bolts.
Hi, Mike. Hi, Kiernan. Thank you for a
Hi, Marie.
terrific presentation. So my question is a methodological one also. Can you describe for us the advantages in this method of storytelling that, maybe compare and contrast it to traditional focus group, and what do you think the benefits of it were?
I think definitely some of the benefits were because we only had everybody only had to answer 3 questions, and they were given more time for questions. So I felt like each answer was really well developed. I was really shocked I felt like I couldn't have told a story like that on the spot, and the nurses pulled out some really, really good ones. I think also, I totally lost my train of thought. Go ahead, Mike, if you have anything to
Okay,
add.
so Marie, what I really thought helped was setting the tone of what we were going to ask them at the beginning of the story circle session and asking them to tell us a specific story about each question from a beginning, middle, and end standpoint, rather than just generically telling us, yeah, working during the pandemic was hard. Each one shared a specific story, and I thought that made our data really rich.
I can imagine you had tremendous amount of rich data.
Mhm.
Would you do it again? Are you going to do it again? Are you going to use
I
this?
want to do it again. I want to actually, I'd love to follow the nurses we interviewed and see where they are and continue with them, because I almost feel like we developed, I don't know what the right word is, Maria, rapport with them. They felt safe with us sharing their stories.
Yeah.
And you saw the post-survey results. They found it therapeutic. So yes, I would do it again.
I mean, to me, it suggests, and you may disagree with this, not in terms of research, but it suggests that approach should be considered by managers and administrators when they really want to understand the nursing experience.
I agree.
Thank you.
Thank you. Thank you for your help.
We're going to take some questions from another virtual participant.
Sure.
So we will unmute Sarah Songer. So Sarah, if you can share your question or comment aloud.
Okay, and this is a comment coming from a nurse with many, many years of experience, probably before any of you, well, definitely before any of you guys were even born. But please keep this going, because I think what you're bringing forth is critical in an understanding, and your comments about managers and providing that. What I'm finding is critically different with what's going on here is when we went through it with HIV and everybody panicked because of what was happening and could I be exposed and what's going to happen. You weren't isolated. You still had support. You sat down, you took your coffee, you got to be able to talk. You could go and follow up. You had a closeness, which is totally absent with what's going on right now. I think it'd be really important to see what happens, and it's not going to be soon, when we can start with that informal interaction. I think the formal interaction, more formal, like what you came up with, is going to be vitally important in structuring this on the interim. And please get the word out and how to do it and how to structure it and what's going on. But also a follow-up for what's the difference going to be with what you were finding when there's much more of that informal, when you're not isolated, it's just you and the patient, and you can't even go to lunch because you're in isolation, because people aren't meeting in the cafeteria. You can't walk out in the parking lot, whatever it is. Please keep it going, and give us what's different when people may be able to start reacting or interacting more informally in the future, because that's been a saving grace in my past experience.
I agree, Sarah, and thank you for the feedback. And we hope to get this out to nurse leaders across the country as well in the healthcare settings.
Okay, we'll take another question from the Q&A feature.
So Mary Louise Kanaski asked, did any participants describe concern for their own emotional or mental health or that of their peers?
I think that they did. We saw, I feel like overall though, the participants really ended, and Mike, you could correct me on this if you disagree, but I feel like overall the participants really ended on positive notes. For the most part, like we saw kind of throughout the stories, I know we've said this a couple times, but Bill had asked everybody to kind of think about stories with a beginning, middle, and end. So I feel like a lot of times the end was almost like a little bit more resilience or hope or confidence or some of those positive things that we talked about. So participants, they definitely did describe concerns, but I felt like they were always kind of hand in hand with the positive things that were happening too within their workplaces because of COVID.
So, Mary Lou, what I would say, I agree with Kiernan. The camaraderie that developed in a 90-minute story circle was amazing. I almost felt like we should have a 90-minute story circle weekly as a support group for these folks. But we did note mental health concerns. Kiernan shared the one quote about the nurse burnout survey that someone bought and filled out, shared with her colleagues. Many participants were very emotional, telling their stories about losing patients during the pandemic. So I do think, I don't want to say I'm not diagnosing anybody with any mental health issues, but there was definitely emotions showed. And we know that high stress continued over time will lead to bad outcomes.
Kim Stripe asked, did you think about capturing years of experience and whether that impacted people's kind of responses? And was there any indication of what would make things better for the nurses?
So Kim, thanks for the question. No, you should have brought that up to me last year about years of experience. But I will tell you anecdotally, most of the nurses were newer nurses, I would say, with under 5 years experience from what we could gather from the interviews. Why? I don't know. We didn't ask. Did they just feel more comfortable sharing? I'm not sure. Were they more comfortable with the technology? I don't know. But that's what we found anecdotally. And Kim, what was the second part of the question, guys?
Was there any indication of what would make things better for the nurses?
They want to feel appreciated. They want to know management and administration cares. They want management and administration to be visible, not just send out 10 emails a day with a new guideline. They want supplies available. They don't want to be told to use the same N95 for a week when last week before the pandemic started, that wasn't the protocol. They're scared. They want support, help, respect.
We have two more questions. Victoria Sherm said, I was struck by the tone of frustration, almost anger in several of the nurses' comments. What was it like hearing these things as a research interviewer trying to be non-judgmental?
Okay, so I don't hide my emotions well. I'll throw that right out there. But on Zoom, you get to turn off your camera as well if you need to, which is something you can't do when you're live with somebody in the room. But it was hard because I'm a nurse and I work hospice and I've had to put on full PPE and I've had to have family say goodbye over, not Zoom, FaceTime. I had to think what the Apple product version was, over FaceTime. And it stinks, for a lack of a better word. And I could relate with their raw emotion, just not to the same magnitude because I'm not doing it 48 hours a week like they are But it was difficult, but I also thought that that helped with the sense of security they felt in sharing their stories and the camaraderie they felt and safeness they felt in the group. Kiernan, you want to add anything?
Yeah, and I could see how it came across. There was definitely a tone of frustration, but I think that the overall emotion coming through was it was more like like almost upset, like distraught, sort of. So it was easier to kind of relate. I know Clay and I sat in a lot of the story circles together, and we talked about how a lot of times we got choked up in the interviews, just from the amount of emotion coming out of the participants. So it's hard to be non-judgmental and not get roped into it as a nurse yourself, but it didn't feel as much anger in the interviews as just more just raw emotion.
So another thing I was curious about in terms of, some of the data and analysis that you did, and I knew you had 14 participants, but did you see any, and you had quite a variety of care settings listed that were represented by these different nurses. Did you notice any either similarities or differences across care settings? Because one of the things that I remember about the beginning of the pandemic was, at least my perception was, the difference in the amount of resources going to acute care settings, as well as maybe some of the more positive media messages about hospital settings and the work going on there versus long-term care settings that had limited resources and a lot of negative stories. So can you, did you notice anything about that in your research?
So Janice, two things stand out right in my head when you asked that question. The one nurse who identified as an ICU nurse, and I found this interesting. She worked in the ICU, but she was mandated by administration and pulled out of nursing education and put back in the ICU where she hasn't worked in over 5 years. So that was interesting. I know that wasn't your direct question, but that, she's an educator. She knows ICU, I suppose, but it's a lot different than working it every day. And the other one that really blew me away when you're talking about different settings was the nurse participant who worked in a type of an infusion center, oncology center. And this patient had belly pain. She knew the patient wasn't right. You know your patient. She probably saw the patient weekly for chemo or whatever. And she knew something wasn't right. And because of the pandemic, nobody wanted to see the patient. The ER couldn't handle seeing the patient, so on and so forth. And that patient died on her 2 days later at home from whatever bowel issue, because no one would see that patient. And now we're seeing that across the country, right? I think it's Iowa that's doing crisis care or whatever it's called. So people are not getting the attention they need. But I don't remember a specific long-term care story at the top of my head. Kiernan?
No, I don't. I was trying to think, and the same kind of stories that were setting specific stuck out to me, Mike, as the same as you. But I think that if we ever went back and sort of asked more about the settings, which I know we've talked about doing, getting people from similar settings, so like more long-term care nurses, more ICU nurses, and kind of seeing how their stories align. So I know that would definitely be a question, like if we were ever able to take this further. So
yeah, thank you.
I think kind of in combination with that, Morgan McAfee asked, how do you think these themes translate for school nurses? Her son's school recently lost their nurse, and just kind of the implications with that.
So I don't envy being a school nurse right now at all. Way before the pandemic, they have way too many students to take care of, if you want my own opinion. Sometimes there's like 1 to 1,000 ratios and things of that nature. It's just insane. And now, and I'm not saying it's wrong, it's probably the safest way, but anytime a child has a sniffle, they usually have to prove they're COVID negative before they could come back into the school setting. So I imagine it's a lot of stress trying to organize things, dealing with parents that are upset, and things of that nature. So do I have any advice except they need to practice their own self-care and really take care of themselves because they are so needed in the school system?
It's also my hope that maybe we can take some opportunities to advocate around the fact you shared, one school nurse for 1,000 students, and that's really a challenge to provide quality of care, comprehensive school health programming, for example, with numbers like that. So, as nurse leaders, maybe we need to look for those opportunities. Did you get any sense from any of the nurses you talked about that you mentioned advocacy as being a theme, advocating for themselves, for their patients, maybe the families, but did you get a sense as to whether they were trying to work? They probably didn't even have time to work on, policy, infrastructure, and some of the things that might potentially make a difference.
You know what, Janice, they weren't even interested. They were so mad at administration. They didn't want to hear about policy. They did what they needed to do for their patients, even giving them their own cell phone to make last calls. They didn't care that they had their own number. They just did what they had to do because at the end of it, they cared for a human being as if it was their own family member.
Yeah. They're really at the micro level and really not able to kind of see that.
And they're exhausted.
Yeah. Are there any other questions?
One more
Okay.
question.
Sure.
Okay.
Diane Barish asked, this seems like a promising intervention. Would you anticipate any barriers replicating your intervention in terms of support from administration for protected nurse time and availability of trained and skilled facilitators?
Well, I think one of the biggest barriers would be, like Mike just said, the anger towards administration. And I think that one of the reasons nurses were able to get so vulnerable and express that anger and frustration with us is that we were not part of an organization they worked for. So I imagine that if this was done within organizations, you might not get the same results, but I would be interested to see. And then I think also, like you mentioned, Dr. Barish, protected nurses time. I don't think that exists right now in a lot of these places. So I mean, I think that a lot of places now are working with not the correct amount of staff and not able to get the correct amount of staff. And while I would love to see this being implemented within organizations for nurses, I don't see right now as the pandemic is still ongoing, how it would be feasible at this moment. I don't know if you think differently, Mike.
So I think it needs to be implemented, Diane. I think it would build up trust and hope and faith in these people. I'm just not sure the resources are there to do it, unfortunately, because nurses are leaving the bedside and they're just looking, and I hate to say this, bodies to fill spots, and thinking about interventions to help them is probably the least thing on their mind. But what could, one thing that always comes to mind at me, what could professional organizations do? What could we do as a college, right? Like, why can't we hold monthly meetings? Why can't the ANA, American Nurses Association or something, hold monthly meetings for these nurses? And I'm not saying the hospital shouldn't, Diane, but there's definitely a place for interventional studies that needs to be done as to what could help prevent these nurses from leaving the bedside.
Well, Mike and Kiernan, on behalf of the CGNE leadership team, as well as all of the participants today, I want to thank you so much for this outstanding presentation, for this important work that you've done. And I hope you continue to do in some capacity to move the voices of these nurses forward and raise awareness. So thank you so much for all you're doing. To our participants, just a reminder that the evaluation tool is required for RNs seeking contact hours, but we do ask that everyone complete the evaluation within 1 week to provide us the necessary data and feedback that's helpful for us. For your convenience, the link to the tool has been placed into the chat. So you can complete the evaluation now if you have time to do so. But if you did register online, which we hope everyone does, even if you're joining us in person, it will also be emailed to you within 24 hours. Again, please join us next week for Speaking Grief Part 2, which I think is a great extension of some of the conversation we've had today. So again, thank you, Mike and Kiernan, for your time, for your effort in planning and delivering this presentation. It was amazing. Thank you so much.
Thank you for the platform to share it.